Thank you, everyone. A little bit of background history. My photography career started with the Ministry of Defence, and I spent 22 years working with them in PR, which gave me a lot of the grounding for working with people. I worked tri-service and covered various different things: aerial photography, PR photography, working with the royal family and things like that. So it was quite a grounding. And when I joined the Royal Free, it wasn't by choice, because the MOD was quite exciting. You know, I travelled, and 22 years they went, nah, bye, thanks very much. And that was that. So I moved to medical, which actually had been a passion of mine from early on, a real good interest. I had work experience in it, and moved there in 2001. Age of 40, doing a degree in medical photography with a family as a trainee photographer in a medical environment. When I joined the Royal Free, they didn't do PR photography. Nobody there, they're all very technically based, and everybody hated it. They thought, no, don't like doing that at all, out of their comfort zone. I came in and brought it into the department, and in a very short space of time established our department as quite a key player in PR photography in the hospital. We use it for patient information, for showing and teaching for healthcare professionals, publications, many different things. And I've got a few slides here showing some of the examples. Some quite cliched images, but they work well, shooting through the donut of a CT scanner, on our ICU ward. We have an admissions unit in the UK that deals with the elderly, so they're dealt with differently in A&E, involving people, all of it, other than the bear on the left. That becomes part of our role. But these are some of the publications I've had images used in, quite diverse. I'm employed by University College London. We provide a service to the Royal Free, hence the university pictures here. Pictures for news stories. This lady, Patricia Lebac, was the longest dialysing patient, they said, in the world. She'd been on dialysis for over 40 years, so it made a key picture. And a shot like that was as simple as it gets. It was available light from the ward window on a 50mm lens. What more can I say? Other things that crop up, Mohs surgery, so removal of cancerous lesions, very topical at Royal Free. We have a department that deals with the dermatologists, plastics trained, and the gentleman on the table there was actually a reporter for the Irish Times, and he hadn't actually realised the whole process of what was going on, and did a nice feature on that. Other lovely stories. Here we have Yvette, a patient who had had her first kidney transplant by a consultant on your right, Ozzy Fernando, renal transplant surgeon, and that kidney eventually came to its end, and Ozzy's son, Bimby, on this side, did her second renal transplant. So it made quite a topical picture. We work closely with the Royal Free Charity. Charities in UK hospitals help provide additional funding. So we have our NHS, which is pretty hard strapped for cash. Our charities do an awful lot of work, and you get bequests from patients, and it's an ongoing process. They provide anything from services to equipment for the hospital as an additional income. Our charity is very proactive, and they run campaigns. As you can see from posters here, they go up around the hospital, and people can contact the charity. So again, slightly different environment. Using people for pictures. I hadn't been at the Royal Free long, and they wanted to do a cover for a dermatology brochure, and that's my daughter at the age of 4 who got dragged into the studio because she had good, clear skin. Untanned, everything else, all the things that dermatologists ask you to look for. So moving on to the PR side in the hospital, you need information, you need to do your research, you need to know your equipment. The information and gathering on what you're going to photograph is key to your imaging. Know where you are, who you're going to work with, what time it is, what format. And moving on from there, just some examples. So this image was for a private healthcare company on dental screening and scanning. And again, in this situation, I was working closely with their designer and publicist for their services. Knowing where you're going to work, theatres, who you need to get information to. Our theatres are managed by a theatre manager. We inform them, or I inform them, we're going up. Our hospital employs, it could be quite small, but in the UK it's quite a big hospital. Our actual hospital is 5,500 staff. You get to know quite a lot of them, which makes the whole process pretty easier. Knowing who you're going to photograph. Paediatrics, getting consent from everybody, getting this passed beforehand. Children, it isn't easy to think about publicising a child picture, and quite often we will try and use children of staff just to make the whole process easier. Although in situations where we have patients that've got good stories, you approach and go down the consent route. It does become more difficult. I did some recent work with Great Ormond Street Hospital and had some pretty good pictures they wanted to use. We went down the route of getting consent only to learn the child had died. It's quite sad as well. Training photographs, quite topical, paediatric resuscitation in A&E, and also knowing how the pictures are going to be used. So actually, are they going to be shot landscape or portrait? So that again, our designers often go, "Oh, just shoot both." It doesn't quite. You've probably got the same problem. It doesn't work the same way. It's different. Knowing your equipment. I used to, with the MOD on some of the big jobs, lug stacks around. Not quite that much, but it certainly felt like it. A suitcase with lighting kit, a couple of backpacks. Now my portable kit revolves around a couple of bodies, 3 lenses, 2 or 3 flashes at a push 4. Light modifiers. I actually use a Gary Fong, which is popular over here. There's a lot of medical photographers now using Gary Fongs in the UK. And of course your old brollies. Most of the time, translucent white for me. Occasional use of a tripod. I prefer a ball and socket. I do panoramics in the hospital. Using an L bracket on the camera just helps positioning, keeping everything central. Knowing your location, I'd like to be in that sort of location more often, but I'm not. But it's more often mundane, almost in things like hotel corporate shots. And this again was a private hospital shoot showing their facilities. Theatre environment again, getting access, timing access. Theatres in the UK, pretty maximised. You usually find you're in the theatres between 7 and 8 in the morning just to get in before a clinical list starts. Also to working in laboratories, often ending up with wearing white coats. Laboratories in the UK can end up with even the staff not wearing white coats. They're not necessary, but you convince them to wear them, because if you have somebody just standing there in their jeans and T-shirt, it doesn't look very scientific. So you get them to pop their white coats on. Observing all protocols. If they're working in a cabinet like this, obviously they're wearing gloves. Other aspects to the labs we have to look out for. We have labs that deal with radioactive elements, and all these cabinets here were lead screened, and I ended up going through the full process. So take your clothes off, put this on, wear this badge, all that sort of thing. Can slow your photography down a lot. Time-wise, we don't get much chance to actually spend a lot of time. A lot of these photographs are created in 15, 20 minutes, not much longer. Intensive care unit, we don't obviously patients here are in a seriously compromised position. We don't even think about consenting any patients in ICU, intensive care. It's more a case of picking the situation, position, and using a member of staff to cover the bed, block the position so the patient is not shown. Drop focus in the background. Techniques, all the traditional techniques that you've got here. Low key, high key, minimal depth of field, mixed lighting. And pictures like this. Mum and child did a campaign in the hospital for our maternity unit. It was shot in a storeroom. I had a literally black pop-up background, white reflector in the foreground, and one key light coming from the other side of Mum. Although, if you're not aware of it, when you're photographing people close together, most people will hold baby about there. Baby in this stage is up here. It's all to do with a camera perspective. High key shots like this. The professor's room was pretty messy, so we shot her in the corridor, and literally it's one flash bounced off a wall. Focal lengths I use anything from, for portraits, 24 all the way up to 300. Using light, psychologist here, interesting design on the wall, single light, stucking up close, bit of shadow, makes a little bit more interesting picture. I mentioned panoramas, they also come with their own problems. So this is shot on our medical assessments unit. A lot of work went into this, as you can imagine. This didn't just happen. It was like mock-up patient on the bed, and all the staff associated with operating that area. The only trouble you get is obviously running a panorama, stitch panorama, running your camera across. Most people expect one shot. So I started taking a shot on the left, and our lovely lady just in front of the trolley walked off. About 10 times into the shoot, and I finally got her to stand still. Stay there. But stay there. And it took a long time to get in, but it's one of those things. Can be very frustrating. Photographs, portraits in theatre, done for this consultant's own website as well as the hospital's, and researchers looking at different things. In this case, zebrafish used in genetic research, and in this image, bit of coloured gel on the background. The doctor here is looking at a a mitral valve made of a nanocomposite material, and in the background are the pumps that test those valves, but quite traditional lighting methods as you find in any sort of portrait environment. We also shoot available light. Baby receiving UV therapy, quite straightforward. And then down to renal transplant through laparoscopy. And this is their operating environment. So they actually work under a blue light. The blue light is actually quite low. It's pushing ISOs up, and I'll talk to you in a bit more. But balancing your screen image with the actual theatre lights and working that one out. They did have actual variable dimmers on the lighting, so it was more helpful. But that isn't images stuck in afterwards. That is the straight shot. Drop focus, longer lens, cyst on the private renal ward with patient on dialysis in the background. And finally a little bit on just communication. A quote I really like, if you know Terry Pratchett, it really does, a photographer, somebody jumping around, shouting at everybody, getting everyone to... Well, I don't shout at everybody, but there's an awful lot of moving and getting people to do things and communicating. People tend to do what you ask. If you're the photographer, they respect you for that. When I work with the MOD and all the ministers and PMs that we photographed, they would say to me, just tell me what you want. You get it done, I get it done, and that's how it went. they're quite happy to do that. In an environment like this, which was plastic surgery, two surgical teams working on a child, their communication is important, but you have to also let them know what you're doing. It was a hustle and bustle environment. They were working on a child who'd been mauled by a dog with multiple lacerations. So you're communicating with them. At the same time, also working with, you get two people in front of the camera, they tend to freeze up. You get them to communicate with each other so they've got that concentration in their eyes and looking what they're doing. In this picture, it's an optometrist checking a patient's eyesight on the ward. And very briefly now, variations on a theme. Don't just take the shot that's straight on. Overhead view, standing on a table, side on and slight angle. Pill cam, not in really a studio. This was shot at a desktop and against a white background. The usual, again, as I mentioned, landscape images, portrait images. There was a patient suffering from Parkinson's. We do patient equipment as well, and these are shots grabbed on portrait shoots of professors. So in the lab, single tray shot with 3 different gels, or no gel and 2 different gels. Gelled light on a server for our IT, binocular microscope in our dental school, and a radiology scanner in our interventional radiology cardiology unit. The patient environment for our infectious diseases unit, and again overhead shot, standing behind the scientists titrating. Again, 50mm lens, 50mm macro lens, standing on a chair, over and behind them. Putting things into perspective, asked to photograph this little box, which was a simplistic tool for teaching doctors how to work laparoscopically. So don't just take that, but take a shot that actually shows what the environment is, what the doctor's working to. Liver decellularization, where they've taken a human liver, decellularized it, so that's now capable of taking stem cells, and to actually then transplant that in the future, once it's been proven, for a patient for liver transplant, and taking from that and showing the actual researcher at work. Keeping hands in shots in these environments, it's not, they want a PR type image, so you're not going to stick a scale in there, so putting a hand in the shot helps to scale the image. Occasionally things go wrong. Just keep clicking. That's what I say, because it does give some fun pictures. This was our pat dog, and one of the staff down with the dog, and well, there we go. Shall we say, the owner of the dog had lost sight on the ball. They weren't paying attention, and so yeah, there we go. Bit of fun. So that's the slideshow part. My other thing I do, a little bit of wildlife, and that was a recent one up in the Norfolk coast in the UK. 3-week-old seal pup. Time. Well, that's why my kit came.